Now you recall that in one of our episodes, we discussed critical care nursing, and we brought one critical care nurse by name Juliet, Kwadzodeh. Now, following that program, we had lots of messages, lots of requests from you, our cherished viewers, to demystify certain ailments associated with critical care nursing. So today, we've brought back Juliet Kwadzodeh. Now, if you want us to demystify any issue that is close to your hearts, just keep watching, just subscribe to this channel, and then like it, put in the comments, and we'll do our very best to bring a professional to come over and demystify that issue for you. Now, for today, we are demystifying a very silent killer. Stay tuned. Welcome back. Like I indicated, we are demystifying a very silent killer known as pulmonary embolism. Pulmonary embolism. It's a mouthful. And we have no meaner person than Juliet Kwadzodeh to help us demystify this critical care ailment. Juliet, thank you for coming.
Thank you for having me.
It was amazing with the very first interview we had on critical care nurse. A lot of our viewers wanted you to come back. So you are here to discuss an issue that one of them requested that we discuss, and it is pulmonary embolism.
Thank you very much for having me, and thank you to your viewers too.
So tell me, what is pulmonary embolism?
As you said, it's a silent killer, and it's also, let me break the two words down for you. Pulmonary means lungs, embolism means clot. So if you put the two words together, it's just the dislodging of clots in the lungs. It can be one or two clots, but the disease happens in the lung.
So where does the clot start from? Or where does it come from?
All right, so the clot comes from the lower or the upper limbs, so the leg or the arm. But more time is on the legs. So we start from the legs. So if you've heard something called deep vein thrombosis, is normally, they call it DVT. When people go to the hospital, they tell them they have DVT, that's deep vein thrombosis. It means there is a clot in your leg. Because we move a lot and the veins there are smaller, it can roll up into smaller clots, and then it will dislodge and find its way into the lung. So when it gets there and it blocks the artery, pulmonary artery, it blocks that place, then you start to get cough, you start to get shortness of breath, you start to get chest pain, and all these are signs of you getting pulmonary embolism.
Now, so you mentioned DVT. Are you saying that when the clot starts to develop in the leg, the patient or the person doesn't feel it? Are you saying that there's no sign to show that some clot is developing in the leg?
All right, so the cardinal sign for DVT looks like a swelling. Your legs become swollen. It's not edematous like water. You can see that when you press it, it's not pitting. You press it to come up. So when you see your legs getting swollen like that, some people also see a bit of pain in their legs, and they go and report it as normal swelling and pain. And so that is how somebody would go to a hospital to report of something like that. Then we can go and take a scan to look into your veins. Then we see that you have DVT. So when we see that, we prefer to give you a bed rest. That is, we'll admit you in the bed, no movement, and then give you the treatment to break down the clots. Yes, so that is how come people come into the hospital with that. But I know on the other side, there are some people who want to do home remedies and herbal medication, so they put some things on them. But as soon as you do it, you are trying to massage the leg, and it will increase dislodging, and it will end up in your lung.
So you're saying that the clot moves from the leg right up into your lung.
Sure.
How long, or typically, how long will the clot take? How long will it take for the clot to travel from the leg to the lung?
As I said, there are people who will report into the hospital and the clot will be broken. If it doesn't break, it depends on how your movements look like and how long it's going to travel from your leg into the heart, because you know all our blood moves from the lower or upper limbs. There is exchange of gases in the heart. We have the oxygenated and the blood with oxygen and the blood without oxygen, and then it goes back to the other parts of the body. That's how blood flows in the body. So obviously you move, there will be movement from leg towards the heart and the lung because there should be exchange of oxygen. So I can't sit here and tell you it'll take you 1 week or 1 month because we don't have a very fair idea of how long it takes. But what I know is that after you get DVT, you are supposed to break the clots and break all the clots so that we can have that flow normally. As soon as we are unable to break it or detect it, it moves into the heart and then to the lung where the exchange will take place. And that is where you get finer or smaller veins, and then it get blocked, and then you start experiencing the shortness of breath, because the pulmonary artery is a major artery for oxygenation of the body. So once there's a blockage there, then that's when you see all these things. The cough is because you want excessive oxygen. So you want ways of bringing whatever it is out so that you can get your oxygen. But because it's blocking a vein, even if you cough, it's not going to solve the matter. It's just like you choking. When you choke, it's blocking an airway, it's blocking your intake of oxygen. So you feel like coughing out the thing so that you can fill in with the air that you want. But at this point where it is, even if you cough, you can't bring it out. So now you start exhibiting the pain, and then you get the shortness of breath. It means you can't breathe well.
Okay, so could you explain what this diagram is all about?
Yeah, so the human body has two lungs. So when you look at this, there is a clot you can see there that is projected to the other side, where you can see how the blood has been able to form a clot blocking the vessel. So if you look at this, obviously there's no way there can be exchange of blood or exchange of oxygen at this point. So that is when the person feels the shortness of breath, the cough, and then the difficulty in breathing. So this is a picture of how the clot looks in the lung.
Yes, but I'm still struggling to understand how and why the clot forms. How does it form?
All right, so there are some risk factors. Somebody who has traumatic accidents, if you get an accident, there's the possibility that you start forming the clot. If you also are pregnant, pregnancy is also one way that people can get formation of the clot in their leg due to hormonal changes. We also have people who are have the risk of high cholesterol, hypertension, increasing the thickness in the blood vessels. All these things help us to form a clot. So if you look at an example of the pipe that we use for water, if your vein represents that, then it means that you are trying for the water to flow. As soon as something becomes thicker, it now starts forming into clots. And there are people who have a tendency of their blood clotting, so they can also start those kind of clots. So with all these, it dislodges along the pipeline. So that's how I want to use it. Dislodges along the pipeline. It doesn't stay there because, as I told you already, there are movements in the blood vessels. You have to move it so that it can exchange oxygen.
Okay, so now the clot has moved from the leg into the heart, then into the lungs.
Sure.
What would a critical care nurse or what happens next? What happens next?
All right, so that is where we come in, because you come in with a complaint of shortness of breath and all that. Once you don't get oxygen into your lung, it will get to a point you become so unconscious, and that is where we have to be able to treat you. Some people come semi-conscious, so we admit you into an ICU. If you need a ventilator, we'll put you on a ventilator, because we are supposed to give you 100% oxygen, so that we can be able to break down the clots for you with medications. So there are certain times that it will require surgery. If it requires surgical intervention, we'll prepare you, take you for surgery. But in the meantime, we'll give you the adequate amount of oxygen that you need in order for you to survive.
Is there a point that you'd say that it's too late to treat?
We never say never anyway. So there is a picture here that we have people who get to that extent of getting onto a ventilator. They don't have access to their own environment, so we do everything for them. As I said earlier, that's our work. So we do all the investigations. So this is a typical example of what I am describing. So we have machines, the ventilator on this other side connected to the human being. We have all the medications that we have in all these machines, and we have monitoring, as well as giving the person some food to eat through the veins. And then we also have a way of monitoring all the things that come out of the machine or the human being. So this is a typical view of an ICU and how we are able to take care of people for them to survive it. In this case, there are also investigations that we do afterwards, and we have to be, because the medications are blood thinners, making your blood very thin. There are short interval tests that we do, like clotting time, how long it takes for your blood to clot is very important to us, so that we are able to maintain the blood thinness, making sure that we are making it so thin enough for you to be able to break down those clots that you have in there. And after that, the patient becomes well. Some become well and go.
Is there a recurrence?
Yes, it can recur, because they are put on blood thinners, oral blood thinners.
And is it for life? Do they take that thinners for life?
Yeah. Most take them home for life, especially when they have some surgical interventions. Some also take them for a period of time, and when they are fine, they stop it. But there is a likelihood of recurrence.
Right. So, pulmonary embolism. What are the chances that a person who has this disease will survive it?
All right, so as I told you already, in the ICU, we have a 50-50 survival. And so we make sure that we are able to give the adequate treatment for people to survive. But sometimes the treatment intervention is quite difficult to get. Sometimes too, you can't get access to some of the medications, and it is a challenge. But in all this, if we are able to diagnose it earlier and get the treatment, people are able to survive it. In the world, there is a percentage that people are able to survive pulmonary embolism because of the quick response and because of the adequate technologies and innovations that they have. But for now, we'll say that about 50% of people survive pulmonary embolism when we see it early. But if it doesn't come early, unfortunately, we lose them.
But here's the case where you don't even feel the movement of the clot to your heart and the lungs.
Sure.
So then how can you detect it very early?
All right, so I told you it starts from the leg, like a deep vein thrombosis. So swelling and all that in the leg, herbal medications and massaging, and sometimes dislodges some of these things. So I think that when you see those swellings in your leg with those kind of pain, reddish, you can visit the hospital early so that we are able to detect some of these things. Early detection is what we do because they are imaging. You can be diagnosed with imaging, and once we take those differentials out, if you go and it's not it, that's fine. But once you get some swelling on your leg and you feel heaviness in your leg, I think you should approach a health facility where they can do a scan at least to.
So how do you prevent it from occurring? How do you prevent pulmonary embolism from occurring?
Okay, so much exposure to surgical intervention is one of the things that can give you pulmonary embolism. Normally when we want people to lie in bed for a long time in the hospital, you see we give them test stockings, the socks, the tall socks that we give. It is medicated and it prevents some of these things. Exercising a lot is one of the things that could help you to prevent some of these things. And sitting for a long time, I think that when you sit for a while, you have to wake up and just walk around and make sure that your blood is moving up and down.
Really?
Sitting for a long time causes some stasis, like stasis is the thing is just sitting down there, not moving anywhere. And so as soon as you move, one of the things you do is that you see that the thing has started rolling out into a clot. So as soon as you wake up, the tendency is that it just moves straight into the lung and the person just collapses. So now for airplanes with long flight hours and all that, people are advised to wear the stockings before they set off on those long flights. Are
you saying even those without the condition
should
wear the stockings before they get on board the flight for long hours?
Yeah, because it prevents, it's medicated and prevents the DVT.
But I'm struggling to understand how the clot would move from the leg through the heart, causes no devastation in the heart, but rather goes to the lungs and causes a devastation in the... How does it happen?
Okay, so from the leg we have thinner veins. As you are moving forward, you have thicker. As you are going into the heart and the lung, you are going to find thinner ones.
Thinner ones.
Exactly. So as you are going along the way, the sludges come together and it looks like a mesh. So it just collects it and make it a bit bigger. So by the time it gets into the lung along the way, you have got just enough to block the clot.
So the assurance is that it is treatable?
Sure, it is treatable. As soon as you get into the hospital early with it, and you get the right medical professionals, why not?
So it shouldn't cause any panic, even though it's a silent killer?
No, it's a silent killer, but I'm not sure I'm here to cause panic. That is why some of us are in the position in that kind of specialty in nursing to assist you to do that. With the medical doctors who are also trained in breaking some of these clots, the cardiothoracic unit like this is a place that you could be safe when you get there with pulmonary embolism. Anywhere that you see a cardiologist, a cardiosurgeon, they can assist in breaking down the clots and then giving the right medications to break down the clots.
Now, in terms of males and females, which of these two sexes is more prone or more susceptible or vulnerable to getting the pulmonary embolism?
Okay, so for males and females, I think everybody has got an equal chance. But for the females, because we have issues of pregnancy and hormones, you get more females because they tend to report more and they come to the hospital. And you know, Africans, we don't have a lot of data. And so to actually distinguish males and females will be too difficult because we don't have the right data. But because more females come to the hospital, you see more females getting or reporting with that. And again, for Africans, we are really prone to this. In the European world, they say 15% of their population, because they have the gadgets and people are educated on what to send to the hospital. Systems are there to get people diagnosed before the time, lower risk or lower incidence rates than the Africans. We have a bit of high, 35% incidence of getting a pulmonary embolism. So I think we should all keep ourselves well and be a bit critical about what happens to us, and this shortness of breath comes once, and I think they go and some people pour water on you and all that, and they think that is fine. I mean, once water has some molecules of oxygen, once you get small, they think you are good. But I think going to the hospital is one of the things that they should consider.
Okay, so what that means we should have regular exercises.
Sure.
We should avoid being sedentary, sitting in one place for a very long time.
Sure. People like sitting a lot from their homes into a car, into their office, no walking, no activity.
What about diet?
Yeah, diet is also good because we have a lot of foods that can help you to keep healthy. I mean, previously I hear people talk about fruits, vegetables, cereals, things that would improve your blood level. We have a lot of vegetables in Ghana that actually improves the movements of the blood, your blood level and all that. So I think that is one thing that could help you, but there are some physical things that you need to do.
Are there any typical kinds of food that helps to any everyday foods that would help to prevent such occurrences in terms of the DVT and all that?
So the dietitian should help us on this. I mean, the dietitian will be very good in planning diet for somebody like that if you actually want to. So I think going to a dietitian would help us, but I know the normal foods that we eat that could give us a blood level, but not specifically for prevention of DVT. For DVT, inactivity is one thing that we should watch out for. If you sit down too long, I mean, you should get up, throw your legs about to make sure that you are okay. Some people even sit to the extent that they get numbness.
Okay.
So you could wake up a little, people sit by their computers and they even forget they are sitting down there a whole day. You can put a reminder on your table. After every 2 to 3 hours, you should get down and then walk around.
So what's the relationship between the veins that appear on the legs of especially pregnant women? How do you call it? Is it
varicose veins?
Varicose veins. What's the relationship between that, the DVT, and pulmonary embolism?
Let's say you're moving from maybe class 1 to class 6. That's how it looks like. So the woman will get varicose veins due to the high blood volumes that she gets from pregnancy.
Yeah.
It will get clots because she has hormonal changes. Then when she gets those clots, because pregnant women sit a lot, and they are expected to rest a lot and all that, so they get a bit of clots, and then it will get into the vein and cause pulmonary embolism. But that is why we have exercises for pregnant women.
Okay.
We have activities for them, and we even at the antenatal class we even organize exercises, things that will help them to overcome all these things. So they should also take their antenatal classes and exercises very serious.
I'm sure my viewer who requested you to come and speak on pulmonary embolism will be delighted that we brought you.
Thank you.
Viewers, we've demystified pulmonary embolism, and Juliet has really broken it down to the layman's understanding of what constitutes DVT and pulmonary embolism. Now, like I indicated earlier, if you wish that we discuss any matter of interest, just like our page, just subscribe to this channel and put in your request. We'll do our very best to get an authority on that matter, to demystify that matter to your understanding. Juliet, do you have any final word for our viewers?
Yeah, even though it's a silent killer, previously it was undiagnosed because we didn't have the specialists to do that. But now we have a lot of medical doctors and nurses who are into this kind of things.
Which facilities?
Oh, there are a whole lot of government facilities and private facilities that you could walk into for health care. Medicine has improved. And so we can actually take advantage of that and to actually get diagnosis before we start treatment. I am calling for people to be a bit observant with themselves, and then make sure that things that they observe, critical things on their bodies, and then report them specifically. I mean, what you say in the hospital can also give the doctor an idea of how to treat you. So your complaints should be quite specific so that the doctors and the medical persons are able to provide the care that you need.
Lovely, lovely,
Thank you.
lovely. Thank you very much for coming.
Thank
you very much
much
for watching Demystified.
Thank you.
Sit you.